Across the world, there are nearly 285 million people who are visually impaired, including nearly 40 million people who are blind. While some live in places where eye care is readily available, many do not. Even in countries where there are a handful of specialists who can treat cataracts and other serious conditions, it can be difficult for colleagues in remote locations to learn the proper techniques to help patients who need it most. As a result, Orbis, a non-profit organization, recently launched the latest version of its flying eye hospital. What looks like a commercial jumbo jet is anything but, as it quickly becomes apparent when boarding the plane, which combines both operating space and classroom space. Jonathan Lord, Global Medical Director of Orbis International, said the new plane continues a mission which began on a much smaller scale in 1982.
Orbis started in 1982 as an organization looking at delivering training to people in countries where that training wasn't available. And we realized that in order to do that, we needed to have a hospital on wheels. What we decided in the end was that we'd have a hospital with wings. So in 1982, a converted DC-8 aircraft flew to Panama to do our first program. And 34 years later, we still use a flying teaching hospital as a core component of our medical training around the world.
From the cockpit back, the plane is wired to be connected. Whether there are doctors sitting in the 46-seat classroom space to learn about the latest advances in their field, to the state-of-the-art operating room and waiting room, where patients will have the same experience they would have in a top-level hospital. One of the advantages to being a fully mobile entity is the ability to tailor the work Lord and his team do to the location they land at on any given day.
Our training programs around the world are geared using a gap analysis to the needs of the countries that we're going to and the partners that we're going to. So our training can range from being very basic, just doing cataract surgery, all the way through intermediate, or to really quite advanced surgery such as corneal grafting. So it's designed to match the needs of the healthcare community that we're going into, to give them the skills to build a comprehensive, sustainable healthcare system.
When the plane does land, Lord said the specially trained staff is able to do a considerable amount even during short stops across the globe.
And that's why part of our work is, one is, yes, we train people on the plane, and yes, we train them in what we think is the best environment that you could possibly have with the most modern equipment and the best supplies. During each program, we're also doing the same surgery in their facility with their equipment and their supplies. And we're working long term to improve their equipment and their supplies, but doing that in what we call ethical procurement. So actually making sure that equipment they have and supplies they have are long-term sustainable in their country.
Lord said the plane's mission makes it different from any other in the sky, as it travels where others do not, helping patients who otherwise may have had no choice but to accept their vision loss.
There are loads of hospitals or hospital facilities in planes or medical facilities. Air Force One has a full ER in it, apparently, although I don't think I've even ever seen a picture of it. There are loads of military planes that have hospitals in. Air retrieval systems, everyone knows about helicopters and retrieval, but they're not geared at training. The thing that's unique about this facility is the fact that we've set it up as a teaching hospital. We have that audiovisual capacity, the training capacity to make it a teaching hospital.
The new jet includes many features which have been seen on older versions of the plane, but also several cutting-edge technology additions thanks to a donation from Crestron, which puts the aircraft in a class by itself.
One of my father's talents was as an engineer and a problem solver. When he saw the first Orbis plane, he immediately saw how our technology for doing audio and video distribution could be expanded to work in this environment. It's terrific to be part of the Orbis mission and to have our equipment on this plane. So it's great when we have an opportunity to really be part of a team like Orbis that is helping to try to save the world and doing such wonderful work.
As the new plane sets off on its first trips around the world, hopes are high that this is the beginning of tackling a problem to help people around the world see better, one destination at a time.